What causes hair loss, and do they differ for men and women? There are many reasons why people can be losing their hair. It could be stress, it could be environmental, it could be autoimmune, it could be nutritional, it could be genetic, and it could be hormonal. By far, the most common reasons why men and women are losing their hair are genetic and hormonal. But there can definitely be problems with your general medical health, your nutritional status, and stress. And we really have a lot of stress going on. What I would strongly advise is that everyone get a great general medical checkup every year. Make sure your blood work is normal and follow up with a really good hair dedicated physician. A good checkup and understanding your genetic history, looking and seeing who in your family has hair loss, as well as a good idea of what's going on hormonally. For men, does it run in the family? Where are you? Are you taking extra exogenous hormones? Are you taking any medications that might be affecting your hormones? For women, are you having regular periods? Do you have polycystic ovarian syndrome? Are you taking oral contraceptives? Menopause. A look into some of these factors can really help understand where and what the causes might be coming from. To learn more about hair loss and to understand more about hair transplant surgery, please visit my website at www.drhalaas.com, www.drhalaas.com.